Jean Watson.
Who is Jean Watson? Jean Watson is a theorist, a founder, and an author. She was born June 10th, 1940 in a small town in West Virginia. And there she was the youngest of 8 children and grew up surrounded by family and extended family. And at the age of 10, she realized that she wanted to be a nurse when she saw her sister's friend having a seizure. And after graduating nursing school, she found her husband, Douglas Watson, and from there they moved to Colorado together. And that's kind of where her career began to take off. She founded the Center for Human Caring at CU's Health Sciences Center in 1986, and they focused on using human caring in the clinical setting. She also founded the Watson Caring Center Institute in 2010, and that's a nonprofit organization. And their mission is to translate the model of caring, healing, Caritas into more systemic programs and services which can continue to transform healthcare, one nurse, one practitioner, one educator, one system at a time. And she's also the founding member of International Association in Human Caring and other organizations. She's also an author and the co-author of over 30 books on research and philosophies of caring and healing. And her works have received the American Journal of Nursing's Book of the Year Award. And she was also selected as a living legend of the American Academy of Nursing. And that's its highest honor for contributions to nursing. And that was in 2013. So she's had a very successful career.
Jean as a scholar. So like Catherine said, Jean was from a small town in West Virginia, and she finished high school, and after that she attended Lewis Gale School of Nursing in 1961. After that, she moved to Colorado with her husband Douglas and attended the University of Colorado. There she received her BSN in 1964, her MSN in psychiatry and mental health nursing in 1966, and her PhD in educational psychology and counseling in 1973. After receiving all of her doctorates and other degrees, she continued working with patients, and soon after, she became the dean and director of the University of Colorado Health Sciences Center in Denver. What is her theory and how did it come about? As we know, Jean was the youngest of 8 children, and after seeing her older sister's friend have a seizure, her dreams of becoming a nurse transpired. In 1961, she moved to Colorado with Douglas, and unfortunately, in 1997, she suffered an accidental injury that resulted in the loss of her left eye, and soon after this, she suffered another traumatic event of losing her husband in 1998. Sadly, her husband was not only her best friend and her husband, but also someone who kept her physically and spiritually grounded. However, through this grief process, she created her theory, and a direct quote from Jean is, "Attempting to integrate these wounds into my life and work, one of the gifts through the suffering was the privilege of experiencing and receiving my own theory through the care from my husband and loving nurse friends and colleagues."
So Jean's theory of human caring was centered upon a transpersonal approach. So she believed that the nurse is affected by her patients and that the patients are affected by nursing care. Her quote in the middle there just talks about how she believes that her work and that the work of nursing connects both caring and like the human as a whole, but then also spiritual factors, and that we as nurses are supposed to be peacemakers. The foundation of her theory was to promote self-actualization professionally and personally. Watson claims that caring fuels and determines our capabilities as nurses. Her theory is centered upon the stigma that nurses can only provide the greatest patient care if their needs are met. So the whole "you can't pour from an empty cup" idea. The 10 curative factors just provide a guideline for nurse-patient interactions, and they stemmed off of her theory. So the first one is the formation of a humanistic, altruistic system of values. Second is the installation of faith and hope. Third is the cultivation of sensitivity to oneself and to others. So just making sure that we are present with our patients and we take care of them, and that we're not just like oh, your arm's broken, that sucks. Like, being personable with them and having compassion for them. 4 is developing and sustaining a helping, trusting, authentic human caring relationship. 5 is the promotion and acceptance of expressing positive and negative feelings as a connection with the deeper spirit of self and the one being cared for. So authentically listening to our patients. And then 6 is to engage in the artistry of the caring healing practices and then finding creative solutions. 7 is the promotion of a transpersonal, engaging, teaching, and learning that attends to the unity of the person. So making sure that when we provide patient teaching and helping them learn, that we're doing so in a manner that they can understand. So we kind of have to dumb things down sometimes. 8 is the provision for a supportive, protective environment that mentally, physically, societally, and spiritually heals, providing wholeness, comfort, dignity, and peace. And then 9 is the sacred acts of intentional basic care involving wholeness, unity, and spirituality. 10 is allowing for miracles.
So the purpose of this theory is to tailor our care to each individual patient. And the goal of doing that is to promote this sort of healing from within. And so that's caring healing through consciousness, which is like the idea of having interactions that aren't robotic or copy and paste, but that are human and unique and personalized to that individual patient. And the hope is that by doing that and like demonstrating that sort of consciousness, it's going to provoke this sort of inner healing that protects, enhances, and preserves a person's dignity, humanity, wholeness, and inner harmony. Like the little picture right there. And then application of caring behaviors, there's providing presence, which means being there. So like if a patient is anxious before a procedure, you can go in the room and check on them and let them know it's going to be okay. There's touch, which is task oriented, is like taking vital signs. Caring is giving a hand on the shoulder or on the hand to let them know that you're there, and protective to prevent them from falling. There's also listening, which is that sort of consciousness. So like not extracting information from them all the time, but actually having a conversation with them. And then knowing your client, so building that sort of rapport. Their interest in hobbies, if you know that they like to go on walks, like before they came to the hospital, you could go on a walk with them around the halls. And then spiritual caring, which is where they get like their comfort, relaxation, or even their religious beliefs. So if a patient asks you to pray, and that's something that you do, you can do that with them. And family care, which is involving their family. So introducing them, introducing yourself to them, having conversations with them, and interacting. They're an extension of your patient.
The 5 perspectives of caring. There's a number of theorists that explore the concept of caring, and this is how the 5 perspectives came about. Number 1 is human trait. That is thought that a person is born with the ability to care, more of like an innate ability. 2 would be moral imperative. So that would be looking at caring as a right or wrong decision. And this is usually affected by the environment we grow up in and the people who influence us. 3 would be affect, and that's a feeling you have or get about someone. This usually is harder to describe, but universally everyone kind of understands what it feels like to have feeling towards others. 4 would be interpersonal interaction. Caring is viewed as an exchange between 2 or more people. There has to be an actual interaction going on for this theory to work, unlike affect with the feelings. And then 5 would be therapeutic intervention. This is unique to nursing because it is a nursing intervention performed to achieve goals and outcomes. And these perspectives, you can choose to just view one theory, or you can blend them together. And then the 8 factors of patient-centered care. So the Institute of Medicine defines patient-centered care as providing care that is respectful of and responsive to individual patient preferences needs, and values, and ensuring that patient values guide all clinical decisions. So the first one would be respect for patients' preferences. So you don't always have to agree, but just being respectful of the decisions they choose to make.
I'm really cold. Do you think I can get a blanket?
Yeah, here you go.
Thank you.
You're welcome.
All right, 2 would be coordination and integration of care. 3 would be information and education. So always making sure that your patient is in the loop, and when teaching points are applicable, definitely use that.
Hey, Kenna, I noticed that you're smoking a cigarette, and I have a pamphlet here about smoking cessation. So would you like this? Because smoking is really bad for your health, and this could
Sure.
give you some information on that.
Thanks.
You're welcome.
4 would be physical comfort.
Oh man, I'm really thirsty.
Do you need some water?
Yes, please.
Okay, here you go.
Thank you.
5 would be emotional support. 6 would be involvement of family and friends. So really making it easy and accessible for support system to come and visit, or to call them, especially we're in COVID right now. So that is more of a normal thing. And then 7 would be continuity and transition. So when a patient is being moved from different areas of the hospital, making sure the transition is smooth and the patient is comfortable. And then 8 would be access to care. So making sure patients know how to access the care they need in case of emergency questions or just concerns.
That is Jean Watson and her theory, and these are our resources. Thanks for listening.